nurse also. I work at a local hospital here with Marie, praise the Lord. And today I'm going to be bringing you some information from the CDC, the Center for Disease Control and Prevention. And what the Center for Disease Control and Prevention does, they are concerned about your health. And they are concerned about not only just, it's worldwide health. It's not just local health. They're interested in you if you're traveling, your health when you go overseas or when you come back home, or, they're interested in the air that we breathe, your workplace, make sure your workplace is safe. They're concerned about all of that. Anything to do with your health. The Center for Disease Control is concerned about that. Right now, I'm sorry I've been running. I get my breath. Praise the Lord. But right now, we're having a problem as far as antibiotics are concerned. And this, my presentation today is on antibiotic stewardship. And they want the community to know that we have a problem. Yes, thank you. They want the community to know that we have a problem with antibiotic uses. And what's happening when you use antibiotics when you don't need it, then we get a resistance to the antibiotics. And that's antibiotic resistance in you. As it's important when you go to the doctor that the medicine that they give you is going to work for you, right? And you don't want to waste your money and waste your time. So what we're interested in right now is winning the battle against drug resistance. The goal, like I said, the goal of the CDC is Center for Disease Control and Prevention is to, in the 2020, decrease the number or inappropriate use of antibiotics. Okay, so it's down to 50%. That's what they want to see. Their goal is to decrease the amount of inappropriate antibiotic use. Of course, here today, and how it's going to get done is we got to educate the public, we got to educate the community so they'll know what's happening, the effects of antibiotics, and use and misuse is what we want to be concerned about, informing and antibiotic stewardship. That means letting you all know, the public know that there's a problem, it's a crisis that can really affect the health of our people. Of course, first we're going to define antibiotics and antibiotic resistance, when we need antibiotics, when we do not need antibiotics, as well as what are the long-term effects of the antibiotic use, okay? Antibiotics are man-made products. They are used for the purpose of fighting infections inside of our bodies. The first antibiotic was made in the 1920s. Alexander Fleming made penicillin, and the penicillin was used during World War II to fight infections for the veterans. And he also received the Nobel Peace Prize for penicillin. And what he said then, when he received his Nobel Peace Prize, is that penicillin would not be able to handle the bacteria that would come in the future. It would not be enough. And we have seen that they have all different kinds of antibiotics available for us. The antibiotics that they use to fight your urinary tract infection won't get rid of that pneumonia in your lungs. So they have different types of antibiotics that are available for it. And so we want to know when we need an antibiotic. Most cases you need an antibiotic when you have surgery. The first thing the doctor does when you have surgery, he'll order an antibiotic before you go for your procedure, and that is to prevent you from getting an infection because anytime they make a break in your skin, an opening in your skin, the first thing is happening, it can introduce a bacteria into your body. So he orders a antibiotic before you have the procedure, and that's called prophylactic, meaning preventing you from getting an infection before, and then he orders the antibiotic after you come out of surgery. And that's post-op antibiotic, and this is to cover you. Another thing that you see happening when you go to the hospital is that they get you in there and they get you out of there. The reason why they move you out so fast is because of the infection that you can get inside of the hospital. Because a lot of times, if you notice, people will come in your room and will not have washed their hands. And then in the hospital where I work, we have a sign that tells people to wash their hands. You know, and you can tell the doctor to wash his hands. You can tell the nurse or whoever comes in your room to wash their hands. Because bacteria can linger on any object in your room. And so what they found out that people healed a lot faster if they got to go home and recover in your normal habitat. And less likely to get an infection that somebody else gave you. And the worst infection you can get is staph. That's right. And it can get into that wound, and you know, you're having a lot of problems with that. So that's when we need an antibiotic. We need, if we got an infection, a bacterial infection. Okay, because antibiotics treat bacteria, not viruses, okay? But antibiotics are drugs made by man. Antibiotic resistant is that the bacteria fights against that infection, that bacteria that's in your body, and it doesn't heal or it doesn't destroy that infection. Okay, so that's resistance. It's like a strong man. I mean, if I know a strong man wants to take over, and take control. And you give him an inch, he's gonna take a mile, kind of thing. And the next thing you know, you got something on you that you can't get rid of, okay? Well, that's what a bacteria do. Bacteria just come in. Now we have, our bodies are designed to get rid of a lot of things. But when we take antibiotics too, that affects our resistance. And you know, affects our immunity, our natural immunity to get rid of infection. So that's another problem. So when we get an antibiotic in, it doesn't work effectively for us either, okay? So when we do not need antibiotics, like I said, antibiotics are for bacteria. We do not need antibiotics if we have a virus. And the viruses that they talked about having are your upper respiratory infections. You know, if you got an upper respiratory, runny cold, common cold, runny nose, I've seen it. People come to the doctor, they got a cough, they've had this cough and runny nose, they got a common cold. Well, I can't remember going to the doctor when I was younger, and I'm not saying my age, but, but I can't remember going to the doctor when I was younger because I had a cold. You know, you just live through it. Well, you know, you just treat it. A lot of times we treat it over the counter. You know, and that's what we're going to have to go back to, because a lot of antibiotics have side effects too. And so going to get it over the counter, a lot of times a little moisture, add a little vapor to, you know, moisturizer, humidifier to your room. You know, change the environment, clean up. You know, because a lot of pollen dust. Come on now, you gotta clean up. You got a lot of pollen and dust that's running around in that house. You wonder why you're sneezing and coughing. It's something in the house, right? So clean up. People go for the flu. Now, influenza, they do have a medication, Tamiflu, that's just for that purpose, for the flu. Now, if you catch it though within 72 hours, after 72 hours, treat it yourself. Because there's nothing else they can do for the flu. Of course, the flu symptoms, you got your headache, body aches, you know, you got to take some Tylenol, get some rest, drink plenty of fluids. You treat the flu yourself after 72 hours, okay? But they do have Tamiflu if you catch those symptoms before the 72 hours. They do have Tamiflu. But you do not need an antibody for the flu. So if the antibodies that we have now won't kill it, then you know, you get a super infection or something, it's going to kill you. So that's why we're trying to decrease the amount. Antibody stewardship is getting you, the community, involved and letting you know. I mean, when you have a urinary tract infection, you need to let the doctor test it. They do what they call a culture of sensitivity to make sure that they give you the right antibody to treat that particular infection. You don't want them to give you just a random what everybody else uses because they use Bactrim. Well, you got an infection, urinary tract, going to give you Bactrim. They need to do a culture of sensitivity and make sure that Bactrim is going to get rid of that particular infection. It says, two, we're going to improve the antibiotics prescribing by changing the way antibiotics are used. And that's changing the way antibiotics are used by you saying, well, do I really have strep throat? You looked at my throat, but have you tested me for strep? You know, that's taking control. You know, you say I got a urinary tract infection, then, you know, what am I gonna, have you checked me? What about my culture sensitivity? Is that the right drug you're giving me? Never. You know, even if it's antibiotic, we should not be taking somebody else's medication. And that's where overdose and abuses come with drugs, is because you're taking something that belongs to somebody else and wasn't prescribed for you, or you having a fatal reaction because you took something you don't even know what it was. And we got a lot of people that do that. They pass off medicine from one person to another family. Well, take this. And another thing with antibiotics, if your doctor prescribes an antibiotic for you, you take it from day one to day end. You take it completely. Antibiotic resistant. Never pressure your healthcare provider, your doctor, to give you an antibiotic. Okay? Don't put pressure on it. I work in the hospital, and I had a patient who came in, and he went to one doctor and got somewhere. I need a shot of Rocephin. Well, guess what the doctor did? Told me to give him some Rocephin. We don't even know why we gave him Rocephin. So, see, these are broad spectrum antibiotics, right? It's supposed to cover everything, but the thing of it is that's how you build up a resistance. You didn't need that big old dose of Rocephin. Another thing is save your antibiotics for the next time. Okay? You know how we do it. Save our antibiotics for the next time. And you become sick and you do not take all the antibiotics and don't take it as what's prescribed for anybody else. But you know, well, I'm gonna say this word, you know, if it's not a full dose, a full course of antibiotics, it's not gonna work for you. You know, you still got that infection, you still got that bug there, and so, but that's the main thing. Any other questions? Yes, ma'am.
Is that resistance, is that permanent, or is it?
The resistance is permanent. And like I said, they're making less antibiotics to cover these infections, and that's why the CDC wants you to be aware of that if it's if your body becomes resistant to antibiotics, you may have